Hi, it's Dr. Po Raval, 35 years in practice as a podiatrist and inventor of Archmaker for plantar fasciitis. So today we're going to talk about the 5 cutting edge treatments, newest treatments for plantar fasciitis. So it's a very hopeful and great time to treat plantar fasciitis. So first, look at the link in my bio first for the 4-week treatment for plantar fasciitis and getting rid of it. However, I do have about 1% of my patient population that they've tried everything, done everything right, and they still get chronic plantar fasciitis. So these are the 5 cutting edge treatments that are giving hope. So the first one is called ESWT. So that stands for extracorporeal shock wave therapy. So it's not as awful as it sounds. It's non-invasive. It is based on waves. So basically these are acoustic waves. So if you remember, waves travel like this, and what they do is they travel between all the tendons and tissue. And by doing so, it breaks up the tissue, breaks up all the inflammation around the tissue, and most importantly breaks up scar tissue. Ultrasound kind of does the same thing, but this is far more effective. So extracorporeal shockwave therapy. Number 2, platelet-rich plasma, PRP treatments. So this is where your blood cells are actually spun down. So we would draw blood, it's spun down into a centrifuge, completely sterile, and then injected back into you. So the platelets end up at the bottom of the centrifuge. Those platelets are taken out and injected right into the plantar fascia. So slightly invasive, it's an injection, but very safe. It's being used all over the body, and it promotes a decrease in inflammation. So very safe, very quick, and usually you can do this more than once as well. Number 3, regenerative medicine. So you've heard a lot about this, at least the words. What it means is stem cell therapy. So stem cell therapy is being used all over the body as well to increase healing. Again, fairly non-invasive. You are injecting stem cells, but small openings, very little chance of infection. There are specific providers who do this, and they're usually hospital-based, and that includes podiatry. So we usually work with a team for stem cell therapy. Number 4, so this is dear to my heart. This is 3D orthotics and footwear. So I've talked about this in another video. You can check out archmaker.net, my website, and it's about 3D printing and how it's revolutionizing medicine along with other fields. So Archmaker, the device that I made for plantar fasciitis, which is available on Amazon, it is 3D printed, and we 3D printed this based on dancers' point position. So 3D technology is being used to personalize foot care and foot issues. So we can make 3D orthotics, which are the inlays that you wear every day during the day for plantar fasciitis, but we can also apply 3D technology to rehab devices like Archmaker. The 5th is virtual reality. So virtual reality, remember virtual reality glasses, is personalizing care for plantar fasciitis. So we have a lot of physical therapists out there that are using virtual therapy. There are exercise physiologists using virtual game plans for plantar fasciitis as well. So very exciting time. So the 5 things again are extracorporeal shockwave therapy, PRP or plasma-rich protein injections, stem cell therapy, 3D orthotics and devices for rehab, and virtual reality. Lots of hope in these, and for those of you who have followed the 4-week plan in my profile and still are having issues, these are 5 treatments that you can seek through podiatry, along with asking your primary care physicians. So hope that helps.